as Ebola fears spread across the nation. We take a closer look at how local hospitals are protecting their healthcare workers.
Live, the news on NBC6 South Florida starts now.
Off the top tonight, the latest on the fight against Ebola in America. Now that a second nurse has been infected with Ebola in Dallas, state officials are taking steps to protect healthcare workers who may come in contact with Ebola patients. Governor Rick Scott says the Florida Health Department has asked the CDC to instruct Florida hospitals on protocol when treating potential patients.
The governor also wants more federal funds to properly equip nurses and doctors. Team 6 reporter Hank Tester joins us live from Miami Lakes, where he spoke with healthcare union workers about concerns with the current protocols that are in place. Hank.
Well, what they're telling us here is that they have the equipment, they have the knowledge, they're set to go, but they just need to know what the latest is, the latest protocol, and what they can do to make all this better just in case an Ebola case comes our way. Let's take a look. The Ebola concern spreads as more instances of infection are revealed. Now a second healthcare worker from Dallas infected. Questions about protocol in hospitals. But how about the health workers and nurses at our local hospital? Who looks out for them? Are your troops out there confident they can deal with it here in South Florida?
I think they will be if we make sure they get the updated training.
The Service Employees International Union represents nurses and healthcare workers at many local hospitals, say they are in constant contact with hospital officials on this issue.
Anytime a new disease is a threat, it's very scary, but it's not equipment we don't have or can't get. It's nothing unusual that we don't use already. It's just how do we do it right.
Governor Scott putting the heat on the CDC. We're asking the CDC to hold a conference call with Florida hospitals on the best training and personal protective equipment protocols in the next 48 hours. South Florida is a transportation hub. Chances of a brush with Ebola not out of the question. Case in point, Frontier Airlines jet, the most recent Ebola victim flew on, was in Fort Lauderdale Hollywood Airport Tuesday. Today out of service in Cleveland for a complete cleaning. Bottom line, healthcare workers in South Florida looking for more information, training, protocol. Their union working on that.
This is the time now to get the training and make sure we have the equipment and the policies all in place.
Okay, back live. Union officials remind us there's a lot of focus, of course, on the victims here who happen to be healthcare workers, nurses in the room where the Ebola patient was. But there's also a team situation here. There's doctors, there are people who prepare meals, food service, and even the people who take the medical waste out. They're all part of this, and they all need to know what the latest protocol is. Reporting Hank Tester, NBC6 South Florida. Back to you.
And Americans are closely watching the latest developments in the spread of Ebola. An NBC Wall Street Journal poll shows that 56% of Americans say the U.S. is ready for a possible outbreak of Ebola, while 42% disagree, including 20% who say the U.S. is not prepared at all. Almost half have positive feelings about the Centers for Disease Control and Prevention, the federal agency most directly overseeing America's response. Just 22% view it negatively.
And Jackie, now that there had been several cases of Ebola diagnosed in this country, we've been hearing terms that may be unfamiliar. Let's break them down. People who are in quarantine have been exposed to an Ebola patient. However, they are not considered infectious unless they start showing symptoms. When that happens, the person is put in isolation. That means they are having symptoms like fever or vomiting. Those people are infectious. Self-monitoring means a person is taking his or her own temperature twice a day and watching for any other symptoms.